Healthcare continues, as you know, to be one of the biggest issues on Capitol Hill. Joining us this morning, San Diego Congressman Scott Peters. We're talking about the bipartisan healthcare plan. Congressman, good morning. Thanks for being with us.
Raul, thanks for having me.
You kind of enjoy a little break from D.C. and coming to San Diego.
Really
right?
enjoying a little break from D.C.
Anything going on in D.C.? Yeah, probably not, right?
Yes
quiet.
and no. Right, of course, yeah.
Okay, let's talk about this bipartisan problem solvers caucus. What is this, and is this just the latest attempt to figure out what in the world's going on with healthcare?
Well, I'm part of a group of Republicans and Democrats who really are committed to working together with each other.
That exists now?
Yeah. Oh no. And I think it's I think the healthcare thing offered us a really good opportunity to do that, where we saw Republicans try to do this by themselves. They had a plan that was very unpopular. A lot of my Republican friends were uncomfortable with that. So we used the Problem Solvers Caucus as a forum to come up with some ideas that we proposed this week to stabilize the insurance markets, keep premiums down.
Is this caucus new? Because there's a 5-point plan that is this a new group that you guys formed, and is it after everything kind of just fell apart?
This group has existed for this is my third term, all
right.
of my 3 terms in Congress. We were really, we've been active in trying to work on a number of things together, like keeping the budget, getting the budget passed, keeping the government open at some times. But now I think healthcare is a good opportunity for us to put some work in.
Who else is in the caucus?
The other Californian is Ami Bera, who's a doctor from Sacramento.
Right.
But a number, we got I think about 50 people altogether. Republicans and Democrats, about half and half from across the country. Not leadership. Our ideas don't come from leadership. Our ideas often come despite leadership. I think that's an important thing. There's a lot of people working peer-to-peer to make solutions, which is what I think Americans expect.
So some of the questions could be, what can you guys possibly do at this point that hasn't already been done, attempted, failed, didn't work in the Senate, in the House over the last, what we've seen in the news over the last couple of months?
Fundamentally, this healthcare thing was handled in the wrong way. I'm part of the Energy and Commerce Committee, which has jurisdiction over healthcare. We had a 27-hour markup of a bill that was already pre-cooked. We didn't have hearings. We didn't talk to insurers about what needed to be fixed, or doctors, or providers, or consumers, patients. So after this whole thing was falling apart, a number of us went and had those conversations ourselves.
Sure.
We came up with 5 things we could do to stabilize the markets, to make sure insurance companies want to participate, want to provide coverage, and to keep premiums down. And that's what we offered this week.
Okay, so in dramatic fashion, obviously, all the Republican plans and the skinny repeal and all this, nothing worked.
Zero.
There's no new plan in effect right now. Obamacare is still the law of the land.
Right.
However, then you hear things like this, where covered California, we're going up 12.5% here in California. It's the 2nd year in a row of double-digit increases. Right. Then you hear about Anthem Blue Cross. They're pulling out as well. This is happening in other states. So what happens now moving forward?
Well, I think a lot of Democrats, I mean, I wasn't there when Obamacare was passed, but I always said it's a huge undertaking.
Sure.
We're going to need to fix it as we go along. In many places, it's been a success. In fact, in San Diego County, our uninsured has gone from 17% to 5%. Yeah. But we have to keep premiums down. We know there's work to be done. And that was the frustrating thing for us, Raul, is that while we know we have things to be done, Republicans have gone off on this plan to repeal it, replace it with what? Let's focus on what we actually need to fix. Let's make sure that the government subsidies are certain. Let's make sure that we have some reinsurance, a backstop for the really costly patients. Yeah. Let's make sure we do what we can to soothe the markets so that insurance companies can write and not hike those premiums for risks. Before
we let you go, quickly talk to me about the GI Bill and the update on that. The House actually passed. So talk to me about that real quick.
A good bipartisan bill to modernize GI benefits for young people coming out want educational, college and technical education, so they can continue their careers and get back into society. One thing we're really proud of is Purple Heart recipients. You have to serve 36 months to get your full GI benefits. But if you're injured on the field of battle and you don't make the 36 months, you weren't getting your benefits. Oh. It's reasonable to have a service requirement, but our law says that if you are injured serving on the field of battle, defending your country, you've met the service requirement.
And that's certainly something both sides can agree on. So
right.
Congressman Scott Peters, thank you for your time.
Thank you very much.
When you're going back to Washington?
I don't have to go back for about 5 weeks, which is fine with me.
Right around
it's nice
Labor
to be in San
Day.
Diego.
Thank you, Scott. Appreciate it.